Our results are, suggesting that, the longer the period that you have RNA shedding, even in your sample, blood samples or urine, you have more chances to have a prolonged disease. There is a particular difference when you take a look at individuals with only Zika virus infection and individuals, as in my country, where you have, more than one arboviruses circulating at the same time, and they have, combinations of, infections. And in this group that we are calling co-infected group, they have a different pattern, in terms of disease development. And what we saw, it was when you have Zika virus infection per se, only infection, you can prolong the time of RNA shedding, but most probably you'll be asymptomatic. And the time for, disease development actually is similar to any other groups that interrupt or just don't have longer RNA shedding. But when you have another infection simultaneously or even subsequently, you can see that RNA shedding is parallel with your development of disease, and it might be also important for severity. For instance, in cases where you have immunosuppression, and that's when you are worried, you maintain your RNA shedding for a very long time, and that, is actually, occurring at the same time that the patient, manifests, no improvement in their, disease or symptoms. For instance, if you have, patient with, liver transplantation or renal transplantation, you're gonna see that they are having, loss of, liver function or renal function. If you have a patient that, is immunosuppressed by drugs, like, patients with, inflammatory, chronic diseases or collagenoses, they are not improving, their symptoms, and take longer for them to stabilize it. Mortality, it was not analyzed in this particular study, but we have, seen that it might be important, to make the analysis as an outcome in particular, groups, especially the ones with, severe comorbidities, as transplanted, patients, individuals with, cancer, HIV patients, which is another particular story, and also individuals with immunosuppressive disease of other, etiologies.